more of what we do actually on a day-to-day basis, both at the state office and through all of our local sponsors and our hundreds of SHIBA volunteers who have completed the training program. And then we're going to wrap it up on a couple of case studies thrown in there, and when you can refer to SHIBA to help out with certain things that maybe are in our scope of practice. So hopefully you get everything that you need in terms of information for referring in the future.
Hi, this is Cynthia Hilton. I'm going to cover about SHIBA, who we are. And we like to refer to ourselves as the Queens of SHIBA, but it's actually spelled S-H-I-B-A. It's an acronym, a nightmare, as many of you are used to over time seeing acronyms for everything, which makes it difficult for our clients to figure out who does what and who is what. The SHIBA stands for Senior Health Insurance Benefits Assistance, which is a kind of a misnomer because we help all individuals that are on Medicare, their family members, their caregivers, and we still get calls from people who say, I'm not a senior, can I get help from you? And the answer to that is yes. So essentially, we are all things Medicare related. So we are part of a national organization. It's called SHIP, which is State Health Insurance Programs. And those 50 states and 4 territories are all sponsored by different kinds of organizations. Some are sponsored by their state DHS organization. Some are sponsored, like we are, by the Insurance Commission state office. We're located at the Department of Consumer and Business Affairs, and we are actually directly linked to the Oregon Insurance Division, which is a good connection for us because the consumer advocates in the Oregon Insurance Division and our program work closely together. We have about 5 full-time staff at our program that we run the program with that throughout the state. And you can see our Christmas picture from a couple of years ago. Tasha Sample used to be with our program. Oregon Insurance Division snatched her for something else, but basically that's the crew. So the next slide has a pretty highfalutin group of words pulled together to describe our mission. Too many words, and essentially our mission is to provide objective and competent information about Medicare health insurance options to all individuals who are in need of that information.
Okay. So as Cynthia said, we are part of a larger network of SHIP offices that are funded by the Centers for Medicare and Medicaid Services, but we are also spread out over the state of Oregon through local sponsors who conduct our work through their communities. Right now we have 17 sponsoring organizations in 32 counties, and they have their volunteers that are working in their communities, and statewide we have 286 volunteers who have completed our Medicare certification training program. And as you can see in the stats for 2013, we put in quite a few hours through our volunteer efforts and through the state office efforts and the sponsors. So we had close to 29,000 client contacts and over 16,000 hours spent counseling individuals that are either on Medicare, they're a family member that is helping to assist a person on Medicare, or perhaps they're not quite ready for Medicare and they just want to, know what lies ahead for them, so they're preparing for that eventuality. And so on the next slide, you can see these are the local sponsors in each of the county communities, and our 800 number has a auto routing system. So when you call the 800 number for the main SHIBA line and put in the zip code, then the call is automatically routed to the county that is serving that particular zip code if there is a local sponsor in that county.
And if not?
And if not, it comes to the state office, and we do handle a fair number of calls at the state office. I think out of the 28,000, close to 9,000 were handled by the state office. So we had a good representation of the state assistance with the sponsors.
So what do we do exactly? Well, we explain Medicare. And health insurance is a complex health insurance. People need to understand how to use it, otherwise they miss deadlines and they find themselves in penalty territory. Oftentimes people have no clue how to enroll. They don't know that when they sign up for their Social Security retirement, or when they receive notification of their Social Security disability income, that's kind of an automatic vehicle that sets in motion that their Medicare card will come to them in the mail. Many people who don't collect their Social Security retirement, and they think they're going to wait till they're 66 so they can get 100% of their Social Security amount, and they don't realize they have missed their deadline for enrolling in their Medicare, and they are now in penalty territory. It's a big shock to people when you let them know that. There are certain rights and protections that you need to understand about access to your Medicare health insurance. You need to know what's covered. You need to know how to access, because if you try to access your Medicare covered benefits in the wrong way, Medicare will not pay. Here's a really good example. If a person falls and hurts themselves, and an aging adult, and maybe a family member might recommend that they should get a walker. Medicare pays for a walker. So the client goes out and purchases a walker at the local Fred Meyer's, and then they call us and say, I need Medicare to help me pay for this $120 walker. That's the wrong way. Medicare is not going to pay for it that way. So we have to explain to them, here's how you get your Medicare benefits to pay for your services. So it can get very complex, but that's what we do.
So the next slide has to do with just a basic overview of how Medicare is structured. For the most part, folks that have a work history, they are paying into the Medicare Part A program over the course of years of working, and when they have accumulated 10 years or the equivalent of 40 quarters of paying into that program, then they are premium free for that Part A insurance, hospital insurance. This covers only when you are an inpatient in the hospital. And I don't know if many people have seen, there's been a lot of news lately, at least I've seen it on the NBC News, about the difference between being an inpatient and under observation in the hospital. So that's getting a lot of attention right now, and Part A only covers when you are actually admitted as an inpatient. If you are not eligible for premium-free Part A, if you haven't had a work history or your spouse hasn't had a work history that you can collect on, then there are graduated amounts for paying for that Part A premium. It's not cheap. It's around $426 a year, or excuse me, a month for full freight, and then there's a prorated amount if you have a partial work history. But for the most part, folks that have worked and have that work history where they've paid in, they're going to get their Part A for free. Part B, C, and D are all optional programs. When they first constructed Medicare, the only thing that they mandated through payroll tax was the hospital insurance, because that was what was the most expensive at that point in time in 1965. But they wanted to make the other option of medical insurance available to the folks that wanted to have medical coverage and for the doctors who wanted to participate in that. And so for an additional $105 a month, you can have Part B coverage, which covers the medical services and supplies, including emergency room and ambulance. So it's not just what is associated with outpatient care. It can be associated with stays in the hospital as an outpatient under observation. So a lot of times our folks don't understand that difference until they've been discharged, and then we have to do a little fact-finding on their behalf. If someone chooses or by default just forgets or doesn't enroll in their Part B, as Cynthia mentioned, there are late enrollment penalties when someone wants to add that Part B later on. The whole purpose of that was to allow all people to pay in so that it would keep the cost down. So waiting or delaying because you think you're going to save the Medicare Trust Fund some money and not run any claims does not hold water. You have to enroll when you are eligible, otherwise you are subject to that late enrollment penalty. Part D came along. I'm going to skip C for the moment. Part D came along in 2006. That's the prescription drug plan. That is also optional, but again, folks that delay enrolling because either they don't take prescription meds or they don't feel that they want to participate in that program, but then later on they have a diagnosis or feel that they want to jump in, they are going to have a late enrollment penalty as well. And the penalties are a little bit different for the Part B and the Part D. We won't go into that detail, but just to let your folks know, if they call us, that they will have that explained to them in detail if they choose to not enroll in those programs. Part C used to be called Medicare Plus Choice, and then they renamed it to go with the rest of the nomenclature, the Part A, B, and C, and D. And this is a way to get your Medicare benefits through a private insurance company that manages your Medicare benefits under their rules. So that might be the Kaisers or Providence or Health Net or whatever else is available in our state that has contracted with Medicare to provide those benefits, and sometimes there are different programs available with that gives that insurance an advantage, like vision or dental or maybe fitness club memberships. So there are some different aspects to Medicare Advantage plans than the original Medicare. The term that is used, however, is actuarially equivalent. That is an insurance term that means that all of the benefits added up under a private managed care plan has to be equal to or better than what is offered under Medicare. So there can be some advantages. There may not be the exact same cost associated with the various services, but when it all comes out in the wash, the benefit package is at least as good, if not better, than what Medicare would offer. So when we're talking about all these insurance options, there's a lot of variation based on who the person is that we're seeing. And Each of the counseling sessions that we provide are tailored specifically to that individual. When you look at the number of options that are available in the state of Oregon, it just is mind-boggling. We can really distill that down to the specific person's needs once we get a full picture of what that particular person is coming to Medicare, what their work history's been, what their retiree coverage might be, or if they don't, if they've had any military service, if they don't have any of those work history related benefits, if they're just coming to us as we call naked Medicare, starting off fresh, then we can look at standalone drug plans if they want to just go with a Part D plan, or if they are in a situation where they need to have a chronic situation, chronic illness managed. We can give them the options that would be suitable for managing those chronic conditions. So distilling down the 33 drug plans or the 78 different health and/or health and drug Medicare Advantage plans. If they want to go with something that is secondary to Medicare, there are 42 companies that offer a secondary insurance product called a Medicare Supplement or a Medicare Supplement. So there are lots of different things that come into play when we are counseling somebody and distilling down for them what direction they might want to go. The use of a computer is absolutely necessary. So we are a computer resource for our clients who are not computer savvy, and we can do these comparisons and kind of, limit their, when you look at the total scope of things, it can be so overwhelming, people just get deer in the headlights. But when we can distill it down and say, this is one way to go and this is another way to go, sometimes it makes a little more sense to them and they can make a better decision on their individual needs. The next slide is just the same situation, only in a pictorial view, so it kind of gives you the way that somebody might look at their Medicare options. On the left side of the chart is Medicare as the primary payer, and then choosing all of the other plans that work with Medicare and coordinate coverage, adding these various components. On the right-hand side, you're seeing the Medicare Advantage plan as the primary payer. Remember, they're privately managed Medicare. Medicare contracts with these companies to provide those benefits, and so the person who is enrolling in that plan is not going to have Medicare pay their bills anymore. That's going to be the new plan, and they have their choice of the menu of options within that market rather than going to Medicare. So people come to us in various stages of income levels and access to resources and their success or lack thereof of financially planning for their retirement, and lots of things have happened along the way to those plans. We know a lot of 401ks tanked back in 2008 and along the way, and so people, the aging adults and Medicare eligibility individuals are finding themselves in a situation where maybe they can't really afford all the costs that go with having access to their Medicare health insurance. So another one of the things that we can assist in helping them figure out what resources might be out there for them based on their income and resource situation. So along with the prescription drug plan that happened in 2006 came the federal extra health program, or LIS, limited or low income subsidy, and it is based on a graduated level starting the threshold is 150% of the federal poverty level and graduates up. So depending on your income level, you might be eligible for assistance to pay for your
drug plan premium and to keep your co-pays or co-insurances for that at a minimum. And in fact, recently there's been another grant that has been renewed. It's been around for a few years, and it got renewed. It's called MIPA. Some of you may have heard this name, but this is a statewide effort to make sure that we're successfully doing the outreach to all those individuals that may qualify for this help paying for their drug benefit. And so there's a special 800 line called the Medicare Savings Connect. And that number is on there, 1-855-447-0155. And that hotline is set up to assist individuals in applying for LIS online. It's an electronic submission that can get a response from Social Security to let people know that they are eligible for this benefit. So this is something that I think is going to be real helpful not only to the clients who are eligible for it, but for all of the caseworkers and INR staff and people out there that can see this person might be eligible and you don't have the time maybe, or they don't have all their information with them, but they can go home and call this line and they can get connected. So that's a pretty important resource because many people have drug costs far beyond what their income affords them the access to. So we explain that program, and we also help people get connected to that application. Also, many people, surprisingly enough, don't know anything about the fact that there is a system in the state of Oregon that is called, the federal name for it is the Medicare Savings Program, but the AAAs and the senior services out there may know it as the Qualified Medicare Beneficiary, or the QMB program, which based on income, people can be eligible for assistance paying that $105 for the Part D premium. Or at the lowest income amounts, they may even qualify for the program, the QMB portion, to actually pay the co-insurances and the deductibles, which are also quite expensive. And for people on real limited income, they would not be able to afford to go to the doctor and pay that 20%, which would often prevent them from even seeking medical assistance when they needed it. We also have lots of information that we can assist people with in patient assistance programs. So we can go to the manufacturer of certain medications, and there's foundations, and there's a system that can provide drug assistance through those avenues. And also we let people know about the Oregon Prescription Drug Program, which is the big bulk buying entity that for individuals who maybe don't have Medicare, don't qualify for any other of the supported benefits, they can at least be a part of the bulk buying and get their medications at a reduced level of payment. So it doesn't help tremendously with brand names, but it's a huge help with generic drugs.
And vitamins that are prescribed, because Medicare doesn't cover vitamins that are doctor prescribed, like the B12 shots or the 50,000 units of D. So OPDP can be a big help in that area as well. I wanted to mention, too, that patient assistance programs have a much higher, most of them have a much higher income requirement for eligibility, sometimes 200%, 300%, 400% of the federal poverty level. And some of them offer that to folks that are in the Part D prescription drug insurance program, and some of them don't. So it really is just kind of hit and miss. So all of us have been challenged lately
and there's the confusion that is going all around concerning the Affordable Care Act. So our program has a role to play in that, what's going on there, and we are helping to clarify for Medicare beneficiaries what the Affordable Care Act means to them. And first of all, anyone that has Part A is covered according to the Affordable Care Act adequately, and they don't have to have anything else. But there's a lot of people out there that maybe don't have the work history, didn't have access to premium-free A, couldn't afford the $426 a month, and declined that enrollment, which they are able to do. So there's a whole group of people that once upon a time it was represented, it would be the rare call that might come in. Well, those rare calls are coming in every single day. So now we are liaising with the Cover Oregon program. We are referring back and forth between Cover Oregon for those individuals who are over the age of 65 who don't have Part A, premium-free Part A, and have options that they're allowed to consider. And so we're advocating for them, and we're opening doors for them to explore those options so that they know what their rights are when they connect with Cover Oregon. So that's been a learning process for all of us in the office, and I'm a point person for that. So if any of you have a client over the age of 65 who's coming to you saying, Cover Oregon said I wasn't eligible, you need to refer them to our office because they're getting a mixed bag of information, and it's not necessarily correct.
Yes, and we do get those calls every day, like Cynthia said. So one of the other things that we do, and a part of our mandate with our grant, is to educate. And we do conduct educational presentations around the state. They could be called Medicare 101, they could be called Medicare Boot Camp, or ABCs of Medicare, or Welcome to Medicare. So it could be called a number of different things, but basically what it is, it's informing people that there is education, because Medicare is complicated, and they can come to a class. In fact, Cynthia and I have recently done some education through Edward Jones Financial Planners, and I'm going out to the Columbia Gorge Community College next month to put on a class, and they're typically between 1 and 2 hours. We have regular classes out at Mount Hood Community College, and these are well attended by the public because they're hungry to know what they don't know about what their Medicare is going to be, because this is a transition for folks from their work insurance or their private insurance or self-employed insurance to their Medicare insurance. One of the other things that we focus on is making sure that folks are aware that Medicare fraud is rampant and how they can protect themselves to keep their Medicare number safe, how they can check their statements, their Medicare summary notices, or their explanation of benefits to determine whether or not what Medicare is being billed is accurate. So making sure that all of the folks out there have a resource in the Senior Medicare Patrol, which is another group of volunteers that are, sometimes they're SHIBA volunteers, sometimes they're on their own, or they're through another agency, through the Long-Term Care Ombudsman. A lot of those folks are Senior Medicare Patrol volunteers, but there are folks out there that are advocating on behalf of beneficiaries who are vigilant about keeping their Medicare trust fund dollars safe from abuse and fraud, and preventing all of those other wasteful practices. A number of our clients call us and need us to help with advocating on their behalf. We had a gentleman who called this morning who was in the hospital, and he did not feel he was getting adequate care, and they were going to discharge him. We can help him stop that discharge if he feels that he's not ready to be discharged. We are hooked into the Medicare system, and we know the Medicare rules say that you can stop a discharge if you call a particular contractor, which is the quality improvement organization in our area, which is called Acumentra. A lot of times folks just don't understand their bills, and they want someone to review those bills to make sure that they're being charged correctly for the services that they've received. Or if they're not getting correct information, we can appeal those charges or appeal those errors that they perceive and get resolution. We are also connected to a Medicare system database called the Complaint Tracking Module. And it's where we have visibility once we file a complaint that we can see how the plan is responding to that complaint, how it's being resolved, if Medicare needs to get involved, if that complaint can be closed after resolution, or if they haven't resolved it, then we can reopen it and get it resolved to the client's satisfaction. So all of these things that the clients or the beneficiaries might have going on in their insurance life or their medical life, we can usually advocate on their behalf so that they feel represented, especially in an area where they don't have the vocabulary or the maybe not even just the weight of saying, hi, I'm from the state of Oregon SHIBA program. Sometimes that carries a little more weight when we're calling to find out the specifics on a particular charge. So that leads us into the when to refer to SHIBA. So anybody who is enrolled in Medicare and has an issue with their Medicare insurance or quality of care issue or prescription medications, anything like that definitely is a valid referral, because this is what we do. We advocate, we look at things, we explain. Usually we can assist people in understanding or resolving some of their issues. If they want to review to see if maybe there's a different insurance option out there. Every year we encourage all of our Medicare beneficiaries to do what's called a benefits checkup. That's where they call us or go online to the Medicare.gov website and review what their insurance is right now and what is available for them in the next year, because plans change, benefits change, costs change. All of those things make a big impact on the decision that somebody will make for their insurance options. Anytime someone says that they think that they have been a victim of fraud, definitely give us a call. We will pass that information on to the Senior Medicare Patrol folks. And if somebody is needing just they can't afford to get a walker or a wheelchair, we've been very successful in hooking people up to resources in their community. A lot of times we have already found banks of materials at senior centers or other associations like Lions Club that can offer folks either low cost or free items that they are in need of, and so they don't have to go out and purchase that item new. There are some times when referring to SHIBA is probably not the most beneficial to the client. Medicare doesn't cover everything, and the three things that Medicare doesn't cover that we get calls about pretty regularly are glasses, dental coverage, and hearing aids. And if it's a medical issue with your eye, Medicare will cover glaucoma or cataract surgery or similar things like that. But when it comes to glasses, the only time Medicare covers a pair of glasses is after cataract surgery. So we really don't have any way to provide them with any information other than maybe a referral to the Lions Club that does provide glasses, and they also are a resource for hearing aids. I did have a client that I referred, and she got a brand new pair of digital hearing aids, compliments of the Portland chapter of the Lions Club, and she was absolutely thrilled. She said she hadn't heard so well in many, many years. So we can refer folks to those entities, but sending them from maybe calling you as a INR to us and then we're going to refer them on might not be the most expeditious route. With dental, we do have a list of dental insurance plans, and we also have been somewhat successful in finding dental, donated dental programs. They are difficult. There are long time waiting lists, and unless the need is emergent, we do have to say to the folks that call us that, you know, this is something that Medicare does not cover, and you will need to file an application for donated dental in your area, or look at maybe a dental insurance plan. The plans are a little varying in coverage. You want to look at them very closely, and we'll put the list of dental insurance plans on our website, which we didn't put in this presentation, unfortunately. Our website is www.oregonshiba.org, and we just got a new facelift on our website. It's part of the Oregon Insurance Division main system, but you can get to it from oregonshiba.org. And maybe we'll have a list of resources, and one of those resources on that would be the dental insurance plans that are available specifically for people who are 65 and older.
Unfortunately, those dental insurance plans are not constructed to deal with emergent dental needs right now. So, you know, they want you to join and be paying your premiums and having your teeth cleaned twice a year
for 12 months.
For 12 months. Before the second year, you might get a very limited amount, I might say, of major dental work. So they're really not for the clients that a lot of us see, which are desperate for something right now. So unfortunately, there's very little out there to address that need. So we're going to talk about a little case scenario that kind of talks about how the SHIBA program can interface with a local aging and persons with disabilities office. And this was a case that actually happened, and it kind of just shows how that interchange can occur on behalf of a client. So I had a gentleman who became eligible for Medicare because he was on SSDI, Social Security Disability Insurance, and he had received his card in the mail. And when you get your Medicare card in the mail, Social Security tells you Part B is optional. If you don't want to pay $105 a month for this plan, this Part B plan, you can sign the card and return it. We'll disenroll you. And so he was trying to live on $924 a month, and he didn't see where he could afford $105 a month. He didn't understand exactly what was happening. He somehow had a notion that he was going to be able to decline his Part B, and he would be able to go to Cover Oregon because he was low income, and there's this fantasy out there that Cover Oregon is going to be able to offer affordable health care to everyone. Well, Cover Oregon is not really for people who have access to Medicare, specifically premium-free Medicare. By the time this client figured out that he had done the wrong thing by declining his Part B, and that Cover Oregon, who had referred him to me, wasn't going to be able to give him affordable health care. So I it told him that he was still in what we call, he had missed his initial enrollment period, but he was now in general enrollment period, and that he could go back to Social Security. He could request to enroll in his Part B. It wouldn't start till July 1st. However, I said, do you have a caseworker? Yes, he says, I do. I said, well, you can go to your caseworker or eligibility worker and apply for the Medicare Savings Program. You can ask for the buy-in letter. Remember, his income was $924. So in that case, he should be able to get a letter saying that the state of Oregon was going to buy into his Part B premium costs. And what would happen in his case is his Part B would not have to wait till July 1st. It would start fairly directly, and any penalty he had incurred by rejecting his B way back when would no longer be attached to not having made the right choice at the right time. And I've gotten used to the point where I tell people, now be sure and call me back if this doesn't work. So he called me in a panic the next day, and he said he had talked to his eligibility worker, who it turned out happened to be a SNAP eligibility worker, which I believe is different than eligibility workers that approve you for the QMB or the Medicare Savings Program. But anyway, this eligibility worker had said, no, you're not going to be eligible for that buy-in until after your Medicare starts. So he had some medical conditions, really, that he needed to be able to see a doctor, not waiting till July 1st. So he gave me the name of the eligibility worker, and I called her, and we had a little conversation, and I suggested that maybe she could talk to her manager or supervisor there and possibly find out that the directions I had hoped were correct that I had given him. Because I'm not a Medicaid expert. I'm a Medicare expert. And it turned out that, in fact, the actual eligibility worker for the Medicare Savings Program said, oh, yes, that can happen. So that was the way that the APD office and the eligibility worker that he knew and SHIBA was able to work together to help this client. And we did it in a pretty direct fashion and directly communicating with each other, explaining Medicare benefits and them explaining the Medicaid benefits so that the client was able to accomplish what was needed. So that's just one way that one little story that tells about how we can work together and make sure that we're taking the best care of people.
And that just reminds me that there are lots of case scenarios, but the net result is that the APD caseworkers are oftentimes overwhelmed, and we can assist with that. We have a very strong network of counselors that can explain certain things to their clients, and we can certainly work with as a resource to a lot of the INR, ADRC staff, so that we're working together on the behalf of the client. And it looks like we have a question. Wondering if he has as of 2014 and that wouldn't he be eligible for OHP? Oh, and you know, it's possible that he would be eligible for OHP plus. And again, we're not Medicaid experts, we're Medicare, so we would defer that to an eligibility specialist to make that determination. Okay. So,
This is Sue Ann again, and we asked specifically for Donna and Cynthia to kind of keep this high level so that you folks wouldn't get too bogged down in the details, but I think they're pretty much through with their presentation, so we have some time for questions. And so if any of you have specific questions, we asked them to tailor the presentation specifically for you folks who are INR and options counselors and out there, just so that you would have some ideas of what the referrals were, and I think they did a really nice job of that, so what we should refer to them and what we shouldn't refer to them, and they have a great website with a lot of good information on it. So we have some time for questions, and so you're welcome to chat those in, and we'll stay on the line a little bit longer. And we may ask them to come back and give us a Medicaid 101.
Medicare 101. Yeah, we certainly can do a much more in-depth, for an hour of Medicare. We can talk anywhere from an hour to several days on Medicare, depending upon how much detail you want.
But we specifically asked them today to kind of give us an overview of what SHIBA does and when those appropriate referrals when you would want to make them.
Now, also, you can see that our names and phone numbers and email addresses are on this PowerPoint, and we welcome you to call us with specific case scenarios where you're thinking that maybe we can help your clients understand their Medicare choices. So, I think one of the best referrals between the APD units and SHIBA are when a person has the level of the Medicare Savings Program where they have SMB, which is the Part B premium is paid for, but all the co-insurances and all the deductibles, they have to come out of their pocket. And many times they can't afford that. So we can counsel those individuals about how they can pay for some of those costs.
Yeah, and we just got a question, maybe mention that there is a webinar available on the SHIBA website under volunteer training that addresses specifically the limits and eligibility requirements for the limited income subsidy as a part of the MIPA program. It says MIPA training, and it goes into detail. It's an hour and 15 minutes. And it's very specific for folks who want to know more about who might be eligible for that subsidy and how the subsidy program works. It does have some specific information for SHIBA counselors on how to apply if they're doing an electronic application and then filling out client contacts. But the basis of the information at the beginning would probably be more appropriate for the options counselors and then INR staff to have more information on that.
Guess what MIPA means? It's a legislative act. It's called the Medicare Improvement for Physicians and Patients Act. Just fun facts to know and say.
So MIPA, M-I-P-P-A.
Yes.
And again, the SHIBA website is www.oregonshiba.org.
Correct.
And we've had a couple folks letting us know that they had multiple people at their site. That's great. If anybody else has a site that has more than one person listening on, we'd like to know that. As soon as we do end the webinar, I want to remind you that there will be an email coming to you with an evaluation. It's actually a SurveyMonkey link to about 6 questions. It shouldn't take you more than about 5 minutes to let us know whether this was helpful or not, and whether we should ask them back for more, different kinds of information, to other topics that are related to this. Again, we asked them today to just keep it at a very high-level overview of what they do and what's appropriate to refer to them. But if there are topics that you would like us to have them come back and talk more specifically about, you can put that in your evaluations, and then we can chat with them about what that might look like. So let's see. It looks like we just got something.
Patients and Providers Act.
Patients,
not physicians and.
Oh, yeah.
She's correcting us.
Okay.
Patients and Providers.
Well, I was close. Physicians and patients are the same thing.
Same thing. Patients and Providers. Yeah, same thing.
So we're not really seeing any other questions here, so I think we're going to go ahead and close out the webinar unless anyone has questions. Again, we want to thank you. We're trying to do at least one of these a month, with overviews of different programs that you guys might use or might refer to. In April, we hope to have the long-term care insurance folks. That couldn't come in February. And again, please fill out the evaluations because they're very helpful to us, and let us know if we can bring these ladies back for some more detailed information. So thanks again. Hope you guys all have a great afternoon. We appreciate you listening in.
Thank you, Sue Ann, for inviting us.
Bye.
Bye-bye.